Hello and welcome, it's Chris from Christopher Hall Training and welcome to this tutorial where we're going to talk about how to loosen your tight lower back. I've broken it into three parts. The first part is the muscles that are involved, so the anatomy of the lower back and hips. Then number two is why does it get tight? And number three, how can we then go about loosening the tight lower back muscles? So let's get started. Before we get started, just quickly want to mention my social media, which you can see on the side of the screen there. You've got Instagram, Facebook, Twitter, and YouTube. So please do come along, like, follow, subscribe. It'd be great to have you there. If you are watching on YouTube, please do subscribe to the channel, click the bell icon, and you'll be notified when I send out my next tutorial. Also, leave some comments below, leave questions below, and any feedback below. More than happy to answer any questions, and the comments and the feedback are always good to have. Also, go down into the description, you will see a link there that goes through to my 7-day How to Overcome Lower Back Pain free course. It's 5 emails over 7 days which take you through to some very simple video lessons on how you can start the journey to overcoming your lower back pain. So again, please do come along there and enroll in that short course. Here are 4 muscles that are potentially involved in your tight lower back. So we're going to start with multifidus, which goes from the base of the pelvis, which covers the sacrum here, all the way up the lumbar vertebrae in towards the ribs. And obviously this will be the same on the other side as well, and it will go up. Then we've got iliocostalis lumborum, which is this muscle in here. So the muscles meet these fibers here, which will be a fascial type tendon tissue, so they will basically connect this muscle in towards the pelvis and the lower back. So this muscle tracks again sort of all the way up, midway up the ribs, and again this will be on the other side as well. Then we come on to the quadratus lumborum, which goes again, if we're talking about the lower back, it joins the top of the pelvis here all the way up the rib cage and then down each of the 5 lumbar vertebrae. And then finally, which is a bit more of a hip and lower back muscle, and the reason I've put it as a lower back muscle is this one goes towards the front of the hip and joins the top of the femur here all the way through the hip and then all the way up to L1 and T12. So it will also go up here, and it has also sort of small fibers that blend into the diaphragm as well. So that is then where breathing would be involved in your rehabilitation because of that muscle. So it goes all the way through, joins sort of L4-5 all the way up to L1, T12, and then some fibers go up into the diaphragm as well. So those are the muscles, or the lower back muscles, that are involved in your lower back pain. They're all deeper muscles. We don't have a great deal of conscious control over them, but what we can do when we look at how we can overcome or how we can loosen these type muscles, we will go through some techniques, some exercises and some stretches that you can start doing where you can start to calm these muscles down so they don't become so tight. Now the hip muscles, there are 2 of them. These are deeper, smaller glute muscles. So we've got glute medius, which you can see here. Now both of these muscles, they attach onto the top of the femur here, which is the bone of the upper leg, and then with the glute medius and with the glute minimus, you've got fibers that go towards the back of the pelvis and fibers that go towards the front of the pelvis. Now the importance and the reason why I include these muscles is because where nerves come out of the spine here, they will not only be a part of the sciatic nerve, which goes down the back of the leg, but they also have branches that come off and feed into this muscle here, which is why I've included it, because it is essentially a muscle that is very closely linked to the lower back because of these nerve connections, and these muscles can become sort of in some regards spasmodic in their function, and then that's where tightness can come from, and then that can impact up into the lower back. And then we've got glute minimus, which is again a deeper lying muscle again, which sits underneath glute medius. So again, it's sort of like a fan shape or a pizza slice shape, which goes from the top of the femur and then across and onto the pelvis. And then this one sits underneath glute medius, and this one sits under the big glute maximus, which would basically kind of go in this type of direction over the top of it. So we've now talked about the lower back muscles. We've also talked about the hip muscles involved. Now what we're going to do is start talking a little bit why it becomes tight, and then finally, what can we then start doing about it? So why does your lower back pain become tight in the first place? Well, it could be a few things. It could be lower back pain, it could be spine instability, or it could be hip instability. If we look at lower back pain first, it's generally a symptom rather than a cause of the problem. So if you have a problem with the disc or the vertebra or the nerve, then your muscles are going to be reacting to that. And if we can sort out the problem with the vertebrae, the disc and the nerve, then that will sort out the problem with the muscle. Closely related to that is spine instability. So again, if there is a problem with your vertebra, your vertebral disc or a nerve, that could be causing an unstable structure of the spine. And again, your muscles are reacting to that instability. Now, this doesn't have to mean there's pain, but it could be just an unstable spine that's causing the tightness of the muscle. And then finally, we have hip instability. Now, the muscles of the hip are very closely related to the muscles and the structures within the spine. And if the nerves aren't feeding the muscles properly, or if the muscles are overly tight, or if they just aren't communicating well from the nerve to the muscle, that can create a spasming effect or a muscle that isn't working correctly. And then that can create instability. And then what muscles can do is react to that and tighten and tighten and tighten. So if we can overcome the lower back pain, if we can improve the stability of the spine, and if we can improve the stability of the hip, what we will tend to find is that the lower back muscles will generally start to loosen themselves. Now we're talking a little bit more about the solution to the problem. Now, this isn't the whole solution, but it's going some way to giving you a beginning to the solution, and then you can progress on. So we're going for 2 stretches and 2 exercises that you can start doing. So the first one is a glute stretch. So what we are looking to do is we've got one foot on the floor at the back here, and then we've got the other leg going across the body in this position. Now, this is stretching not only glute max on the back, but also what we've talked about, the back portions or the posterior portions of glute medius and glute minimus that sit underneath. So we're looking at this sort of side to back of the pelvis, which is going to start to help calm down the muscle. It's going to start to relax it, give it some much needed, in some respects, nourishment that it needs to start calming it, so it then doesn't become so tight, so then that doesn't impact on the lower back. Now, what I've given you here is a kind of middle of the road option. What you can do is you can lie on your back. You can then pick up a leg and you can then rest it on the back of the second leg. So you've got head up here, then you'll have the leg going across there. And then what you can do is you can grab onto this leg and pull in that direction. So you've got the leg going up and across in this sort of position. You're pulling this other leg back, which is then going to stretch this area. So that's one option that's potentially a little bit easier than this one. And then you've got a harder option, which is essentially exactly the same as this one, but this knee is going onto the floor. Now, that's only just going to intensify the stretch. With it being raised up, it just gives it a little bit of respite in respect to the intensity of the stretch. So that's a nice easy stretch to then start stretching your glute muscles. The second stretch we're talking about is the iliopsoas stretch. Now, we're mainly focusing on the psoas muscle, but the iliacus, which is this part of it, which is another hip flexor, this one is involved as well. So what we need to do is come down onto one knee. We then migrate this knee forwards, so you can start to see it sort of come. So how I start this is I start with a sort of a vertical shin, but then I shift my weight forward onto this knee. So this knee comes forward like so, and then what that's doing, that's creating what's called hip extension through the hip, and then that is stretching the psoas, which goes from the top of the femur here all the way through the pelvis, joining onto L's 5, 4, 3, 2, 1, up into T12, and also up into the diaphragm as well. Now, the importance of this stretch is not only for this muscle, but also for the diaphragm. So this is where I would now start introducing breathing. Now, breathing is going to be important through these two stretches and the two exercises that we're going to talk about, but it's much easier to bring it in here because of the connection to the diaphragm. So if we have short, sharp breathing, or if we hold our breath, that's what we are communicating to the psoas and other muscles as well. So the muscles become stiff and tight. If we can control our breathing, so if we can say do a ratio of 1 to 1, so 2 seconds in, 2 seconds out, or 3 seconds in, 3 seconds out, or 5 seconds in, 5 seconds out, if we can start doing that, that will help the diaphragm relax, and then it will start to relax the psoas muscle and the glutes and the iliacus and the muscles of the lower back. So not only are we going into these stretches performing the stretch, we're also going in trying to relax the breathing and keep it as controlled as possible. So those are the two stretches we're focusing on. Now let's go and look at the two exercises. Exercise number 1 is the side plank, and it's a side plank that you may have seen a lot before, but we're going to try and keep shoulders vertical, hips vertical. I'm putting my top foot in front of my bottom foot. And there's nothing wrong with you guys putting both feet on top of each other, but I'm just putting those there just for a bit of extra stability, and I'm just keeping this hand out of the way on my hip there. What we're also looking for is a nice straight line going down through here. We don't want to be sort of kinked up, but we also don't want to be sort of bowed down as well. Okay, so we want a nice straight line going through ankle, knee, hip, up into the shoulder, and also keeping the head in line as well. So you can start to see I'm sort of drawing a nice box around my body, so I got those nice straight lines. Now what this exercise is doing is exercise is working these muscles here and the glute medius, glute minimus, TFL type area in the hip. So we've got hip muscles functioning and we've got core muscles or lateral core muscles functioning. Now what this is allowing us to do, this is allowing us to brace our torso so it can then stabilize the spine. So we've talked about hip instability and spine instability. Well, this is where these exercises are able to aid that, in so much as when we abdominally brace, we stabilize the spine. So the muscles of the lower back, so you've got iliocostalis, you've got quadratus lumborum, you've got the psoas going all the way through, and you've got the multifidus down at the bottom here as well. So you've got all these muscles down at the bottom of the pelvis which are going into spasm to try and stabilize the spine. Now, as a general rule, that can be in part because we aren't bracing the abdominals here. So if we can train to do it, these muscles will automatically calm themselves down and they won't start spasming quite as much. And it's the same with the muscles in the hip. So if we can start not only by stretching and relaxing muscles, we'll prevent that type of spasm type effect, but if we can get them then functioning correctly, and if we can get other muscles functioning correctly, we can then start to overcome that spasming tightness effect that we get around the lower back. So it doesn't mean that we need to stretch the lower back, it means that we need to get the muscles functioning correctly. And that's what we're doing when we start the side plank. The final exercise is the bird dog. Now, the bird dog is slightly different to the side plank, in so much the side plank is working a little bit more on the abdominal brace and the tensioning of the abdominals and the hips. This is now working a bit more on the stability. So what you can see here is I start on all fours, so I would have this hand down here as well, so that would be in that sort of position, and this leg would be down in this sort of position going back as well. What I'm then doing is I'm lifting my left foot and my right arm. So I'm lifting the opposite arm and opposite leg. Now what this is doing, this is creating instability from the right side here to the left side here. So it's causing my torso and my hips to become more stable. So what we've done with the stretches is we've started to relax and loosen the muscles off. What we are now doing with the side plank and the bird dog is we are now sort of training them to act appropriately. So we now want them to create tension in the side plank, and we want them to react in a more subtle way with the bird dog. So if we have hips that are rolling all over the place, or weight shifting from side to side, or we're wobbly at the shoulders going from side to side, or sort of up and down as well, what that shows is there's instability through this diagonal channel through the spine. So what we need to be able to do is train this along with the stretches and the side plank to become much more stable and much more level across the hips and across the shoulders. For the very simple reason being, when we gain balance, we gain efficient muscle usage. So they're not reacting and they're not pulling our body from side to side because one side reacts and then the other side has to counteract that. Once we can get them stretched out and calm, we can brace appropriately, and then we can create more stability through the bird dog. What we then do is the muscles start to act more normally and more appropriately. And what this allows us to do is loosen the tight muscles of the lower back. Because as I mentioned earlier, tight muscles of the lower back is generally a symptom of a problem rather than a cause of a problem. So if we continually stretch the lower back, then we're only really sorting out the symptom, and then the symptom comes back. So they'll loosen off for a bit and then they'll come back. If we've got back pain, it can make it more sensitive to the pain. So what we need to be able to do is stretch appropriately and exercise appropriately. And these two stretches for the glutes and the psoas, and the two exercises, the side plank and the bird dog, will start you off on the journey to loosening the tight muscles of the lower back. So many thanks for watching. Hopefully this is helpful. Hopefully it's given you a better idea of the direction that you need to go in with regards to loosening your tight muscles. And don't forget, please do come along to the link that's in the description, which is just here, which goes through to my 7-day free program, which is all about how to overcome lower back pain. Alternatively, come to my social media, Twitter, Facebook, Instagram, and YouTube. Like, follow, subscribe. It'd be great to have you there. Many thanks for watching. My name is Chris. I will speak to you in a future video.